Congenital heart disease is actually the commonest birth defect occurring in about 1 in 100 babies, but it varies from mild to severe. Very severe or critical congenital heart disease is where the heart chambers or where the heart vessels have not developed normally in utero. And about 3 in 1,000 babies will be born with such a critical congenital heart lesion.
As a practicing pediatric cardiologist, it's always a big concern, and as a mother I can understand how very hard it must be when you have what looks like a seemingly normal baby and then being told that this baby has severe congenital heart or even critical congenital heart disease, and how that affects not only the baby but the whole family for forever.
Pulse oximetry screening is a newborn screening test where we would have a small simple sensor or the hand in one foot, and it reads the oxygen level in baby's bloodstream. One wonderful success story is a young girl, POPSiCLe Nyambane.
It was the third day.
And she was actually in the discharge room, right, ready to leave.
She saw the signs because she thought it was just the wind that the baby had all the time.
The pulse ox screening test discovered she was actually fairly below the normal oxygen level, and soon realized something's wrong and discovered her vessels had not formed correctly.
I was shocked and confused because nothing did go wrong when I was pregnant. I was scared, but doctor, she gave me hope here. I'm thankful that they did the test before she got home.
If we have a diagnosis, we feel so much better when we know what it is. It's much worse for babies that pass away or are never diagnosed and their parents don't realize that it was actually a heart condition that caused their demise.
No, it's worth knowing everything about your baby. I also decided to stay at home and look after her after the operation to see how she is coping and everything, but she's doing fine.
She's never needed hospital admission again. She is now nearly 1.5 years and a beautiful big girl. Since I've seen a few babies with critical congenital heart lesions at Mowbray who unfortunately went home before it was picked up and then returned in extremis, shocked and near death, I really felt we should start a screening program, since it's done internationally, seeing if we can pick this up before it leads to all those problems. POPSiCLe comes from the words pulse oximetry pre-discharge screening in newborns for critical congenital heart lesions.
It spoke to some of the desperate needs around congenital heart disease, and for us it just seemed a very easy way to identify these children.
It was a challenge initially because we had not sufficient staff members at that time, and absenteeism obviously played a big role.
It makes me feel good because we saved their life. We now could have peace of mind, and we would like to implement it now as routine care in our wards.
I'm actually very excited about POPSiCLe so that, as I said, we can make a difference in those children's lives.
It's all about caring. Besides the fact that we are giving professional care, we also need to care for people.
I love you, my baby. Love you so much.